I want to provide a little bit of an overview to Parkinson's disease before we get into the details of the pathogenesis and the pathophysiology, just because it's so complicated and there's a lot of things going on, and I thought this might help a little bit. So the first thing we'll start out with is just a very simple timeline, and this is one of the things I think is most interesting about Parkinson's disease, is that there is a trigger that appears to occur sometime in the earlier years, young adult years. Scientists don't know what this trigger is. They're guessing. There are a number of hypotheses out there, but they don't really know. And uh, then clinical diagnosis occurs 25 or 30 years later. Well, clinical diagnosis is done by effects or motor symptoms that are seen in patients. And there's a video that I've provided after this one that gives you an idea of what doctors look for to actually diagnose Parkinson's disease. But they're looking for things like that resting tremor that's characteristic of Parkinson's disease, sort of a pill rolling movement, also with the hands, rigidity, and issues with walking, things like that. These are all symptoms of the central nervous system, so musculoskeletal, and working with the motor component of the brain. But there's something going on here for 25 years, and scientists have been thinking, well, what might be happening here if we can try to figure it out? Maybe we can catch this disease a lot earlier and have a lot better chance of actually having an impact on how this disease progresses. Remember, by the time clinical diagnosis occurs, about 70% of the neurons that produce dopamine have already died. So there's not a lot left to work with. So they have known for a while that there are a number of non-motor symptoms that seem to be associated with Parkinson's disease. However, it's been difficult in the past to really make this connection because these are very non-specific symptoms, and you can see them all listed here. Um, and the idea here is you still have that trigger, and there's going to be some sort of pathogenesis, something happening in the body. But again, if you can catch it earlier, you have a much better chance of treating this disease. And so one of the things that they're really looking for right now is if there's some sort of a biomarker that can identify if somebody has already sort of started this uh, movement into Parkinson's disease. And I will note here, these non-motor symptoms are really associated with the autonomic nervous system. The end result of Parkinson's disease is Lewy bodies, and these are found in all patients that have Parkinson's disease when they do an autopsy. And in fact, they're actually found in patients that also don't have Parkinson's disease, and they're trying to figure out why that is. But again, all patients with Parkinson's disease show Lewy bodies, particularly if they have died at an old age. They have these Lewy bodies in the brain, in the middle section of their brain, and sometimes even out near the cortex. And just want to cover a few things again with risk factors. Mention some of them above in the discussion. So family history and maybe pesticides, and that was all kind of looked at just based on what they knew about Parkinson's disease and some of the occurrence in the upper Midwest and things like that in the US. But a number of epidemiological studies have suggested that there may be an association between basically how we are living. So all of these things that tend to be associated with high reactive oxygen species, oxidation, basically, sort of an acidic body system, all of these things appear to possibly either impact Parkinson's disease or actually be a risk factor. And so I think the big takeaway here really is that there's this huge time over which this disease is developing. And whether you have this trigger or not, it would appear that how you sort of live your life, what you eat, and how active you are can really have an effect on whether you ultimately develop Parkinson's disease or not, and potentially, if you do develop it, how badly you end up having it. And I just want to take a little time here to give you a sense of where we're looking at in the brain, particularly when we're talking about these dopamine producing cells, the motor skills. Again, that's what's most known. And so this is a cross section of the brain, and here we just see the substantia nigra. They don't actually show a piece, but it's just this little tiny thing about the size of a pea. And it's associated with this nigrostriatal pathway, which is the red here. And the important thing to note here, and we'll get into this in more detail when we talk about the pathophysiology of Parkinson's disease, but is that there is this connection between the substantia nigra and the striatum, and then there's also the connection between the striatum and the cortex, and it's ultimately these connections that are affected that impact the motor movement of seen in Parkinson's disease.